Hi everybody, welcome you on my this advanced health YouTube channel. What is a Muga scan? A Muga scan tells doctor how well your heart is pumping blood. This is known as the ejection fraction, which is the amount of blood pumped out of your heart's lower chamber ventricle with each heartbeat. A radioactive substance called the technetium is injected into the veins in your arm and allow us to see the pumping action of your heart using a special scanner called a gamma camera. Gamma camera. This is the picture of gamma camera. You also watching on your screen this time. Muga camera. Gamma camera test specially used for the cancer patient. Preparing for the skin. You can have a light breakfast or snack before the skin, but not a heavy meal. If you are pregnant or think you may be, please telephone us before your skin, as we may be able to arrange an alternative test for you. Please don't bring children with you to avoid the unnecessary radiation exposure. Please contact the department if you are breastfeeding, on dialysis, incontinence, claustrophobics, and require the assistance with the mobility. What happening when you arrive? When you arrive in the department, you will be taken into the preparation room. We will ask you some question about your medical history and about any medication that you're taking and as well taking. The cardiac physiologist will then apply some electrode onto your skin and put a blood pressure cuff on your arm so that we can monitor your heart rate and your blood pressures. A fine tube cannula will be put into a vein in your hand so that we can give your injection during the test. What happening during your test? We will give you two separate injections 20 minutes apart into cannula thin plastic tube, it means in your hand. The second injection is radioactive. After the second injection, we will take a series of images using a gamma camera. Gamma camera. The stationary doctor will be placed around your chest. Your head will be outside the scanner. The scanner is quiet when it is working. ECG, electrocardiogram. Electrode allow the images to be triggered by your heartbeat so that we can look at your heart muscles movement. Now, how long is the test? The resting Muga test takes between 60 to 90 minutes. In some cases, 30 minutes and 20 minutes. After a study, after your scan, there will be some radioactivity left in your body. This will not present a significant risk to another people around you. There is no need to stop giving the children ancient love and care entirely. However, for 24 hours after your test, we advise you to try to keep any time that you spend close to others, especially pregnant women and the children, as short as possible. Is this test safe? Oh, there are no side or after effects from the injection of the radioactive agent. You will not feel drowsy and you will be able to drive home after the tests. There is a small risk from the radiation exposures, which is similar to a CT, computerized tomography scan. This small risk is outweighed by the information that will be gained by taking the scan. Or doctor will have checked the request for the Muga scan to make sure this is the appropriate test for you. No, traveling aboard. It is perfectly safe for you to travel aboard the day of your skin. But the many airports and the seaports are now equipped with the very sensitive radiation detector. So it's possible that the very small amount of radioactivity left in your body could set off a detector as you pass through the security. Therefore, if you intend to travel abroad within a week following your scan, it could be helpful to take within you some things to explain that you have recently had a nuclear medicine scan. This could be your appointment letter or some other official confirmation from the department where you had your scan. How will I get the results of this Muga test, especially in the case of cancer patient like the breast cancer patients and other type of cancer patients? The result of your examination should be available within 2 week of your scan and the 2 and less than 2 weeks. We will then send a report to the consultant or the doctor who requested it. They may have arranged to see you again to discuss the result or may have told you how you will get the results. For example, be letter via your GP. Please note we cannot discuss your result with you in the person on the telephone. This is because we have to report your examination results to the person who referred you to us. If you do not hear anything within the 2 weeks from the person who referred you, please contact them